Hey everyone, this is the Sibo Project. In our last video, we talk about what is ASD. Now let's go through the different types of ASD treatment. ASD is recognized by its core deficits, which include social communication and restricted repetitive behaviors. These ASD treatments are just some of the widely used treatments to improve a person's learning journey using its different techniques. Let's have a brief discussion about each treatment. First, Applied Behavior Analysis Therapy or ABA. ABA therapy focuses on understanding why a behavior occurs. Behavior is defined as anything a person does, and these behaviors are also what we target to either increase or decrease. For example, increasing the behavior of requesting to get what he wants may also result in decreasing the behavior of crying to get what he wants. ABA therapy aims to improve socially significant behaviors. These are the behaviors that will help in improving the quality of life of a person, which includes language, social, and so on. Furthermore, ABA therapy uses the ABC of learning to understand and teach behaviors. This explains why a behavior occurs and how learning takes place through consequences. Antecedent indicates what happens before the behavior occurs. Behavior is the action of or what the person does, and consequence indicates what happens after the behavior. Another important part is ABA uses reinforcement as a consequence when teaching a behavior or skill, which then leads to an increase in that desired behavior. The next one is Relationship Development Intervention or RDI. It is a cognitive developmental approach that targets the core deficits of ASD. RDI aims to build what's called dynamic intelligence, which means the ability to think flexibly and the key to improve the quality of life of a person with ASD. What's great about RDI is it's a family-based treatment where parents are trained by RDI certified consultants to be the primary therapist of the learner. RDI uses a step-by-step approach to build motivation and teach skills such as social and emotional skills. When the first steps, which include parents and learners' relationships, are established, other developmental goals will follow, such as interaction and learning with other people in different contexts, with peers, for example, and more. Sensory integration therapy. It is used as a treatment for sensory integrative dysfunction, which may be observed in some persons with ASD. When a person's brain does not normally integrate or interpret sensory inputs from the environment, either over or under reacts to stimulation, this affects development, information processing, and behavior. Sensory integration therapy focuses on three basic senses. This therapy is performed by occupational therapists and physical therapists. Sensory integration has the following goals. Communication interventions are designed to develop communication through vocal or with the use of augmentative and alternative communication. These are some of the commonly used AAC tools in developing communication for individuals with ASD. These are very important, especially for learners who have not yet developed speech or vocals to express what they want and need. Whichever is accessible and easier for the person to use can be applied as a tool to communicate. And lastly, treatment and education of autistic and related communication handicapped children or TEACH is a method called structured teaching. Just like other treatments, TEACH is performed by certified practitioners and consultants. Structured teaching is designed to help persons with ASD learn and perform using visual supports to provide meaning, promote independence, and capitalize on strength and interest. Furthermore, the framework of structured teaching focuses on physical organization, individualized schedules, work or activity systems, and material structure and visual supports. Any or a combination of these treatments will be beneficial for the learner. Learn more about each of these treatments by visiting their official websites or consult with certified specialists. And as always, love all the learning opportunities.